I am so excited to welcome a special guest who has been a big part of my life and always a part of my support system through my personal journeys. Alexis is a physician's assistant for an OBGYN where she helps women navigate the ups and downs of pregnancy, fertility, and overall women's health with her compassion and expertise. She has been my friend since 2009, from high school to conversations about motherhood. She has been there through it all. When I was navigating the challenges of pregnancy and loss and IVF, she was a person I leaned on, not just for medical advice, but for her unwavering kindness. And she was always just there for me. I remember one time we were sitting at Katie's Pizza, and it's just one of my favorite memories because I was like, Alexis, I got all these things going on. Like, break it down for me. Like, help me out. So anyway, welcome. Thank you for being on the podcast.
Thank you. I'm so happy to be here.
Yes. Can you tell us a little bit about your education and your career path and why you chose women's health?
Sure. So I did my undergrad degree at Mizzou and then took a gap year to get patient care hours before applying to PA schools, which is a pretty common requirement prior to starting. And then I got accepted into Stevens College, and so I made it back to Columbia for grad school.
We gotta love Columbia.
Gotta love it, baby. And so that was a 27-month program. And then I graduated in 2021 and have been doing women's health ever since. And then I think you asked about why I did women's health. So we do, as PAs, we're trained in everything. So emergency medicine, surgery, psych, family medicine, women's health, all of the different areas. And so I was going through my rotations, and I truly love medicine, but as I was going through all of these different specialties, I was just like, okay, could I do this forever? Could I do this every day? And nothing was really clicking for me. And then my very last rotation was women's health. And that's when it all just kind of came together. I was like, wait, I could do this every day?
Yeah.
And the answer was yes. So
I feel like that is what you're meant to do.
Yes, totally.
I see it.
Yeah.
And tell us about like what's challenging about being a PA, what's so rewarding about it.
I think the challenging part is just the dynamics of medicine today. So I think you and I talked prior to this about just the distrust in the medical community, and that really gets me down from time to time. But then there's also just so much that's rewarding, whether it be just patients feeling better or even just like establishing patient interactions. Like I have some really close patients that, if I wasn't their gynecologist, that I would be their friend, so like just seeing them and interacting with them and celebrating their wins outside of health, just, a lot of that is so rewarding to me.
Yeah, I'm not your patient, but I feel like if you walked into the office and I was sitting there as a patient, I could really find trust in you and love who you are. I can just see it. Yeah. And do you have any advice for PAs that are aspiring to be in the field?
So in St. Louis, it's a pretty heavily saturated nurse practitioner specialty. So I think there's myself and one other PA who I went to Stevens with in women's health currently. I think it's really just networking is how I got my first job. And then after that, you have the experience under your belt. So it, makes you a good candidate for other jobs, But I think my best advice would be just networking. Yeah. Knowing the right people to get your foot in the door without that prior experience or that specialty, because NPs specialize versus us.
Yeah. Can you tell us the difference between an NP and a PA?
I would say the biggest difference is that they have that strong nursing background. So I wasn't a nurse prior to going to PA school. They were nurses prior and then went to further their education and getting a master's in nursing. I think even some get doctorates in nursing too. Whereas I have a master's in medical science, so we kind of follow more of the medical pathway to education, similar to a physician in that just our training is similar. But other than that, I mean, it depends on state laws. So sometimes there's PA favoring states or NP favoring states. I would say Missouri is more NP favoring, but it's pretty similar.
Yeah. It's interesting.
Yeah.
Can you kind of walk us through just like what does a day in the life of Alexis look like as a PA? Like how do you go about patient care and what patients bring to you? And when you walk in the office, I'm sure you deal with all sorts of things. I always think about my OBGYN and I'm like, my goodness, the roles that they play. You know, they might be helping one person with just like an annual exam, and then the next moment they're talking about fertility treatments, and then the next moment someone's pregnant. I mean, I just feel like there's so many roles for an OBGYN.
Yes, so there's a lot of variety, which I think is what drew me to women's health, because no two visits are the same, even if they appear to be the same on paper.
Right.
You know, so today, for example, I had multiple well woman exams, pap smears and things like that. But then I also had girls coming back from college and needing refills on birth control and, just talking to them about their futures and sexual health and things like that. And then there's also procedures. So I do IUD insertions or Nexplanon insertions. So those are types of birth controls that require a procedure for insertion. And so I do those too. I had a cyst on someone's breast today that I popped, and they're just truly
all the roles,
all the
roles,
all the hats. Yep. Yeah.
So how did you get like the training for all of this? Because that is a lot of different things to learn. Was it mostly like on the job, or was it through your rotation? How did you gather the experience needed?
Yeah. So I would say school definitely helped give me a good foundation of just overall practicing medicine, and being in all those different areas helped me with, I would say like I can do, like the breast cyst today that I drained, like that was probably more of like a surgical rotation kind of skill set. And then the bulk of my learning I think has come from post-grad, just being in the office, doing the work, trial by fire.
Yeah. I mean, don't you feel like that's with every job? You can learn, you can read a textbook so much, you can have someone tell you so much, but really until you're like immersing yourself in it, it's very hard to know what it entails.
Totally.
Right?
And then I have the most supportive group of physicians around me that if there's something that I don't know or, need help with or want a second opinion on, they're right there. I can bring them in and
it's important to have those people to rely on.
Totally.
To
because
learn from.
I think, school was like drinking out of a fire hose, right? Like there was just so much information crammed into 27 months and then so many skills that we're responsible for too. And then to not have a residency like physicians do, it's like hard to kind of hone in on all of those skills, So definitely just trial by fire and having the right people around me to kind of mold me into the provider that I am.
Right. Mm-hmm. And I just feel like it's who you are, you're just an amazing person. And I feel like you're an advocate for people. And I think that's also so helpful in the career path that you chose.
Thank you.
Can you talk a little bit about how you support people through pregnancy? If someone comes in and they're having some issues like struggling with fertility, how do you support those kinds of people?
I would say the biggest thing that I do would be emotional support. I think we're taught that you have sex and you either die or get pregnant, whenever we're younger. Yeah. And so we think that it's so easy. And we
really do.
We do.
I thought it was going to be easy.
Yes. Yes. You are exhibit A, like we just are not well educated on our bodies or about sexual health or about fertility or anything. And I think that's why it's so important to have these conversations, because then it just makes it more normal. Yeah. And then I don't have the people coming in my office and they're like, obviously something's wrong with me. And it's not always the case, like, of course you can have female factor infertility or male factor infertility or whatever it is, but most of the time it's just, there's something completely out of your control. So I would say first and foremost, I provide a lot of emotional support because I think that's so necessary. And then I don't do a ton of prenatal care in my current role. I do more like preconception counseling and then kind of pass them to the physicians who will ultimately deliver them. So it's important for them to have that rapport. But, and then if there's some sort of infertility discussion, then we kind of just do a brief overview over what are the causes of infertility. And then I usually refer STL Fertility.
We love STL Fertility.
We love them.
Shout out.
Shout out, baby.
Yeah. So I just have a question. Have you sat in on birth? Like, have you done the labor and delivery thing? I know you've seen a C-section. I wish you could have been at my C-section. That would have been fun, right?
That would have been so fun. I would have loved that. I think anyone else would feel like it's weird, but I don't. I just don't.
Yeah.
I would have loved that.
I know.
Maybe number 3 if we want one.
Oh.
So I have watched vaginal births in the state of Missouri. I cannot deliver on my own. I would have to become like a midwife or go back to med school or something like that. But I also just don't have the desire to. So
yeah,
it's just not a strong passion of mine. But I have been involved in labor and delivery to a small degree. And then also I assist in C-sections from time to time.
Yeah. Tell us like what that's like.
Well, I did one last Friday.
Ooh.
Yeah. So baby, it was second C-section. So it was just a scheduled repeat C-section. And yeah, baby was great. She was 6 pounds, 11 ounces. Perfect.
Oh
and
my goodness.
Yeah, parents
it's such
are both
a miracle. Mm-hmm. Like, is it so incredible?
It's so incredible because the process is like I don't know if you want me to go into depth on a C-section, but
7 layers.
Yes.
I know that.
Yes. Okay. So you're going through the layers and it's just layer by layer. And then you get to the uterus and then you cut the uterus open and then then all the fluid comes out and then I'm pushing the top of the uterus so that baby can come out, and then the drape drops, right? And then you get to hold up the baby, and that part of it is so sweet because you're walking into the room thinking, okay, I'm performing a surgery. Well, I am not. I'm assisting in surgery. And then whenever that happens, it like breaks it up for a minute. Like it all kind of falls to the side and you just realize that like you helped bring life into this world.
It's so amazing. My favorite moment of a C-section is when they drop the blue drape, and then the clear drape is there.
Yep.
And I saw, like, they didn't do that for Mac for some reason, but with Lottie, like, Dr. Minguez, like, held her up.
Yeah.
And it was truly the most incredible moment, and we have the most amazing picture.
It's so sweet.
It's so cool.
I know, I'm a little emo.
Yeah. And so can you just tell us, like, when people are going through difficult times, I know you said, like, you're there mostly for emotional support. Can you tell us just, like, a little bit about what that looks like? Because I think some of it probably catches you off guard sometimes. Like, you don't always know what you're walking into. Like how you said, when you see the sheet, it might look like the same appointment, right? But it's not.
Yes.
And someone might bring up concerns. And just how do you go about that in your daily life?
I think that's kind of like one of the biggest running jokes in our clinic is like, what are you going to get? Because what's on paper is totally not, it's like Instagram versus reality, but like to the umpteenth degree, right?
Yeah.
So I think first and foremost is just listening. People need a space where they can feel heard and supported, and whether I even give feedback or not, I feel like is irrelevant at times. They just need someone that is not in their life that's going to tell them, oh, it'll be okay. Or like someone that just knows what not to say, to when they're struggling in that department, I think is really valuable. So I think, definitely listening. And then, I've been known to cry a few tears with them, give a hug, that sort of empathetic support, but also just educating. There's so much, like I said, that we just don't know. As society, because we just our education doesn't allow for that sort of stuff. So
it's kind of like when you go to do taxes and you don't know anything about taxes.
Yes, suddenly you're supposed to be this expert, and you're like, wait a minute.
Yeah.
Where was this?
Right. But I will say the best doctor appointments that I walk out of and I feel like good about them, right, is that I was listened to. I knew that they cared for me.
Yes.
It's not always like we came through this major breakthrough of like, what we're going to do or whatever.
No, but it's just the getting it off your chest and the feeling safe in the environment that you're doing so. And then, I just feel like people need to feel heard. They need to feel respected and protected in what they're telling you, and it's just really important.
It is.
Yeah.
It is. And I know that you do that for people. Just knowing who you are and like being friends with you for so long. And I know that when I just like go to dinner with you, I feel like I'm heard. I feel like I'm listened to. So I know that you're doing that for your patients too. So I hope they come see you. I hope you get like a ton of clients patients from this.
One thing is, I will listen to you.
Yeah.
I just think it's so important. Like, how yucky do you feel whenever you are talking to someone, not even just like healthcare providers, but how gross does it feel whenever you're pouring your heart out to someone and they're just not listening?
Yeah. And I think there was also some maybe teachers for you of like that modeled that, right? Because you told me which OBGYN to go to. I laid out, I was like, this is what I have going on.
Yes.
And she does that.
Yeah.
I feel like she's a great model for that.
She is.
And so I think that's just important that you have models of that and that we keep that up like through the physician's world, like the bedside manner. And I feel like it maybe is getting better year by year.
Yes.
Right?
Yes. I think probably what comes or why it's getting better is because of patient satisfaction scores. Like that's what we're pushed. Like we're pushed that like you have to have good scores and that's like your worth as a provider. And so I think that matters now more than it ever has.
Yeah. Can you talk a little bit about that? Because I feel like we have access to our doctors. Like, back in the day, we couldn't email our doctors. We couldn't send a MyChart message.
Yeah.
We have access to you like all the time now.
I think.
So can you talk a little bit about that?
Yeah, I think it's really great for patients. I think it's made it really hard for providers.
Yeah.
So like where I believe that people should have access and be able to get an answer, a question, a simple question and an answer without like, having a phone call go in and then never getting a return, like I think those things are important, but it's also can be really exhausting, like having the unlimited access. Like I think back to, I don't know, it was like 7 p.m. on a Sunday or something. And so then like the next morning I got the MyChart message and it was like, how dare you not respond to me kind of thing. And it's like, okay, well, we're human too. Like we have off hours as well.
I think sometimes we forget that, even like as patients or, as me being a teacher and I have parents and students and things. And I think sometimes it's easy to forget that everyone is a human being.
Totally.
And we all have our own lives outside of our jobs. And I think that can be hard for people to remember sometimes because, I have been guilty of shooting a MyChart message. Okay.
Yeah. Well, and that's the thing is like shoot it whenever you want, but just be realistic in what your expectations for the response, right?
A good 24, 48 hours.
Absolutely.
Yeah.
You're going to get it from me in 24 to 48 hours for sure.
Yeah, exactly.
Yeah.
Business hours.
Yes, let's be clear.
Not over the weekend.
Yeah, but I think it's really great for patients. Like I think they can see their results, they can see the, what we write about them. Like they know about their health equally as much as we do, whether they educate themselves or not, like, like whether they use those tools or not to do so.
Yeah.
I think that it's a blessing and a curse, but I do think that it's really good for the patient side of things.
I'm laughing because you and I, we were on that My Mercy app. We were reading through my chart notes.
Yes.
Remember?
Oh my gosh.
Yeah, that was fun. So let's just talk about educating women about their health. I know you've kind of mentioned it and talked about it a little bit and how there's such this disconnect between like what we learn in school and then what actually happens in real life. And how do you kind of like make up for all of that? And like, is there anything we could do as a society to kind of, educate young girls more before they are in and sitting with a PA or with an OBGYN?
Yeah, definitely. So to answer the first part of your question, I think, those conversations just kind of start at the well woman, right? Yeah. So seeing where they're at in life. Okay, are we thinking about fertility? Are we not? Some people are just not on their radar. They, they want to be childless and that's perfectly fine. But then there's some that are like, it just kind of opens the door for questions, right? Yeah. So just keeping that open dialogue so that they know that no question is too silly or, whatever. But I think that they, end up asking a lot of questions. Like once they realize that like, okay, she has this knowledge.
They're in a safe space.
Then that opens the door for those questions. So, and then obviously the preconception counseling. So people that are like, okay, I want my IUD out and we're planning for pregnancy, or I want to stop taking my birth control. What does that look like? So I think the most important thing that I try to do is to be open and honest about what that looks like. About it's not you just try once and then it's done, like it's all good.
That would be nice.
That may be the case for some people, but it's not for the majority of people, right? So just giving them those stats of like, if you have unprotected sex during your fertile window, that percentage of you getting pregnant is like 25%, not 99% like we think, So
that's what they make you think in school.
Yes, you have sex, you either die or get pregnant.
Right,
Yep.
exactly.
Yep, so I just have them go in with those more clear expectations, because then that kind of eliminates the back end of the disappointment of like, okay, it's been a year, we've been trying, then they just know that like, okay, what's the next step? We're moving down the process versus this catastrophic thing of like, what's wrong with me? It's my body that's broken, so.
Yeah. Can you talk a little bit about, what would someone do if it's been 12 months of trying to conceive? What would be your next step after that? Yeah.
So I always say it takes two to tango. So we got to figure out if she's ovulating, and this is in, a heterosexual relationship. So if she's ovulating, we need to know, or if she's not, we obviously need to know. And then also, what's the sperm quality? What's the sperm count? So that's usually where I start, because if one of those two things are off, then we have our answer, right? Versus going down this rabbit hole of all of these different tests and things that we can run. Or
there can be a lot, because I had about 20 vials of blood taken before I knew what was going on.
Yes. So I always refer for semen analysis, test heel fertility, and then I get a progesterone level near the end of cycle. So that's the first thing I do. And then if that doesn't give us our answer, then we typically try some sort of ovulation induction. And sometimes that just does the trick. Like, even if they are ovulating, just giving them that little, like their ovaries, that little boost, I say.
Which would be Clomid.
Clomid or letrozole.
Right.
Yep. And then from there, I would probably refer. But the physicians, that's a lie. So there's a step in between that. Then there's physicians in my office that'll check the patency of the tube. So see if your tubes are open. Because if there's a blockage, then like hormonally you may be ovulating, but if it can't get through the tube, then that's a physical issue, right? So versus like a physiological issue. So they check patency of the tubes, sometimes check for endometriosis if their clinical picture warrants that, and then I would refer.
Yeah, each case is so different.
Different. Yeah. And there's just like no clear cut anything.
Yeah. Can you talk a little bit about PCOS, and just because that's what I have, right? And what that means for people, and what that might mean for what fertility looks like for someone that has PCOS?
Yeah. So PCOS is like the most buzzy term right now on socials and stuff. Like,
I do see a lot of TikTok.
There's lots of TikToks.
Lots of opinions.
Lots of opinions, but also like it has a lot of similar symptoms to other things, so a lot of people feel like, okay, I saw this girl on TikTok, she had the same symptoms as me, so I must have PCOS. You must, because that's the only other thing. But, okay, so that was a caveat. But truly, PCOS affects everyone differently. Yeah. Like there's the textbook version of PCOS, so you're having irregular periods, you're not ovulating, you have facial hair and acne, and you can't lose weight, Or you have polycystic ovaries, so meaning you have multiple follicles in that string of pearl sign, that textbook sign on an ultrasound. So it just doesn't look like that in real life. Like some people have like polycystic ovaries. Some people are perfectly stick thin and having regular periods, but they have the insulin resistance of PCOS. So there's
when someone tells me they have PCOS and they're stick skinny, I'm like,
you're like, okay,
yeah,
sure,
I need to see that.
That's cute. Yeah,
I need to see that on paper. I need to see your my chart.
Yes, let me see your my chart. Yeah,
pull it up.
So it's it doesn't look the same for everyone. So I think that if there is a concern, going to a provider that again listens to you and will test for the appropriate things. And
I think that's the hardest thing, is getting someone that you feel comfortable with.
Yeah.
So what if you don't feel comfortable with your OBGYN, or maybe you're not getting the answers that you think you deserve from your OBGYN? What would you suggest someone do?
So I would first ask yourself, do you trust this person? Like, do you trust their medical knowledge, right? Because just because they're telling you that you don't have something, it doesn't mean that they're also saying that your symptoms aren't real, right?
Right.
So I think that's a big discrepancy that I see a lot is like, I could tell you that you don't have PCOS even though the girl on TikTok told you that you did. And then all of a sudden I'm not listening and I'm, I don't have proper medical knowledge or whatever, like not me specifically, but just in providers in general. So do you trust this person? Okay. If that answer is no, then you go somewhere and you find someone that you trust, and then also just advocating for yourself in a respectable way. If you feel like something is wrong, then advocate until you find that answer.
Yeah, it took me a long time to kind of learn how to advocate.
It's hard.
It is.
It's hard because it can be intimidating. You're in front of this person that you're supposed to respect. But I just think that's not how medicine is anymore.
Yeah.
Like medicine is very much a two-way street. It's a conversation between you and I, and we're going to make this decision, the decision that's best for you, and we're both going to make it, know, ultimately with you having the final say. And that's super important. So I would just encourage people to find whoever that is for them and not stop searching until you find it.
Exactly. Like I moved like OBGYNs like twice, and I was just like, I think my time is up with this provider. Yeah. I'm ready to move forward. Reached out to you. You got me, my girl. She's great. So thank you for that.
Yeah.
And I'm very guilty of watching those TikToks and kind of like that like unsolicited advice, right? Like, how do you now there's so much social media presence for medical concerns.
Yes.
So how do you navigate when someone comes in and they're like, I saw this, I know I have it. Or I'm on WebMD, I got this. What do you do?
So first I hear their concerns, right? You got to listen first. And that's the only way you're going to build rapport is by listening. So I listen to their concerns. Sometimes that like guides me in a different direction and then I can redirect from there. But if it's just them saying like, I saw this on TikTok, I think this needs to happen or whatever, I just ask them, okay, can you show me what you saw? Because there's so much out there. I don't know what people are seeing. Like they're seeing the craziest things. Girls are pulling out their IUDs. Like there's crazy things. Oh boy. Sorry, everyone. But
no, that's
okay.
Like
there's crazy things on TikTok.
That's not on my feed.
Well, it might be now. It might be now. Yeah. So I think that one, knowing what they're exposed to is important because then I can kind of like redirect from there, and then just encouraging them to know their source, right? So is it WebMD or is it Mayo Clinic? Like, is it this functional nutritionist or is it a medical doctor? Like, so it's just knowing your source, and that's really important.
Yep. I agree.
But sometimes it takes a little extra work.
Yeah.
Like, because people get convinced, and they feel like, I think they feel validated in what they're seeing, and then I'm coming in and invalidating them, so that takes a little fancy footwork.
Yeah. And I'll say that every time I Google my symptoms, pretty much I'm dying.
24 hours, you're gone. You are gone, baby.
Gone.
Yeah. Yeah.
Totally. I mean, I don't know exactly like what I put in, but no matter what, your girl is dying.
Oh, yeah.
Yeah.
R.I.P. Cass.
Yep.
Yeah.
Okay, so let's do some rapid fire questions.
Let's do it.
I feel like this is going to be fun.
Okay.
All right. What's a skill that you use daily that might surprise people?
My poker face.
Ooh.
So people tell me the craziest stuff. Like, you would not even believe some of the things that people tell me. And it's not like the time of the mask anymore. So I have to just be like,
oh, yeah, no mask.
No mask. So I can't hide behind it. Where COVID times were good for that.
Yeah.
I could hide from here up. I could hide it,
Right.
But truly it's just keeping a straight face and then,
I mean, that, you kind of have to like practice that.
I think 50% of my job is acting, but not in like I'm not being genuine way. It's that, like, it's controlling everything else, like my emotions, my reactions, all of that. Like I just have to like dissociate for a bit and then regroup after.
Yeah, I always say to myself, I'm like, okay, I can be present at work.
Yes.
Right? And then I can leave work at work.
Yeah.
Sometimes.
Yeah.
I practice this. Mm-hmm. And then I can be present at home too. Sure. And I'm sure that's the same for being in an OBGYN office. Yeah. There's a lot of emotions in there. And just being present in it and doing it all during the day and then leaving it at work. Yeah. I'm sure it's hard to do that.
Sometimes, yes. Yeah, sometimes for sure. Yeah.
Okay, here's your next question. Are you ready?
Yep.
One thing you wish all patients would know about their health.
That it's yours to advocate for, and that the majority of us out here in medicine are innately good. Yeah. You know, like we aren't doing this for money or whatever else people think we're in it for, because it's like truly not fun. Like think of any, like most of the time it is, but like it's really draining. And so I just encourage people, instead of just jumping on the bandwagon of distrust, find someone that you do trust and know that we have your best interests at heart, because we're not in it for fun. Yeah. You probably have fun, like, do you guys do any like fun like office things like dip day? Or we love a potluck. Ooh. We're very food motivated women. Yeah. You know, there's a lot of us women in there. And there's some men too, but mostly us women. And we're like, listen, when are we eating next? Nah. You know, we keep candy jars full. Exactly. Yeah.
That's how you get through the day.
Healthy stuff.
Healthy.
The 3 Kit Kats I had today just to survive.
Yeah. I'm always snacking. Skittles, peanut butter M&Ms. I got them in my desk.
Heck yeah.
All right. Tell me a funny moment from your time as a PA.
Okay. So the thing that comes to mind is one day at work, I think it was a Friday, and it was just like dragging on. I was dying, ready for the weekend.
Ready for those 48 hours?
Need it. Necessary. It's medicine. So better than drugs. And I walk in and I'm like, introduce myself. Hi, I'm Alexis, yada, yada. And I'm like, how are you? And she goes, I'm here and I'm queer.
Oh, I love the confidence.
I know. And so every time I think of like, announcing that I'm here, I want to say that. I'm straight, but I just loved that energy,
I do love that energy. That's fun.
I'm
you
here
need
and
a
I'm
patient
queer.
like that.
Yeah.
Because they bring the life back to you.
Yes. Because there's others that are in the door next, behind the next door, and they're taking a straw and sucking the life out of you. So I would say, that was my favorite. I think of that often. Yeah.
I love that.
Just good energy.
Yeah, I love that. And okay, last one. What do you do to recharge after a long day?
Stare at the walls.
Yeah, I do that too sometimes. I don't get a lot of quiet time.
Yeah, you just need it. Like I talk all day long, and then I'm talked at also, like, so just as what is it called? When you're
I'm not knowing.
Extrovert. As extroverted as I am, sorry. Yeah. As extroverted as I am, it drains me, so I just got to go stare at the walls and I'm like, honey, I'll talk to you later.
Yeah. I'm kind of thinking there's a lot of things that are pretty similar to teaching.
Oh, yeah. You're just talking to little humans.
Yeah.
And I'm talking to big humans.
But I got to put my poker face on.
You have to.
Mm-hmm.
The things that you probably hear, I could not even imagine.
Woo!
Or, like, you have to not call someone's kid a jerk or, like, whatever else you want to call them. I could not.
Yeah.
You're doing the Lord's work.
I know I'm going to heaven.
Yeah, you are.
Yes. We know you're going to heaven, too. After, like, popping cysts.
Saving lives one vagina at a time,
There you go. That's heaven worthy.
There you have it.
You don't have to do anything else. No more tests.
No more tests. Yes.
We're both on a straight path right to heaven.
I hope so.
Oh my goodness. Well, thank you so much for being here with me today. I have thoroughly enjoyed this, and I think it's time to set up number 2.
Let's do it. I know this is our podcast now. Sorry, Blake.
We're taking it over.
I know. Thank you so much for having me. This was
and tell us where to find you.
The Lady Parts PA on Instagram. I don't have a TikTok.
Okay. Well, maybe after today.
Maybe I'll
might
just
be
put my white
signing
coat
up.
on and start dancing.
I want to see it.
We'll see. We'll
All
think about
right.
it.
Well, we're all going to follow you on Instagram.
Please
I
do.
already do because I'm a
should.
great friend.
Yeah.
And I love all your posts.
Thank
But
you.
I think everybody else should too.
Thank you.
Give her a follow.